Here's another simple device that you can keep at home and use to help with relieving general back pain or back fatigue or stiffness. It's called the SAE arc, and I'll show it to you here. It's made up of high quality wood that's shaped into an arc. And as you can see, it's durable quality. It's not one of those flimsy plastic things. It's got this little stand, little notch that fits in like this. And you lay it on the ground and lay down on it and in different positions. So what's with the arc? Well, your spinal column has arcs in it, curvatures, and those curvatures impart strength to it, very much like how a spring imparts strength to something and enables some flexibility. The lumbar spine or low back has what's called a lordotic arc or lordosis. So normally when you stand up, it's supposed to curve like this, but some people have it in a flex position or in a hypolordotic or straightened, like a stick low back, but it actually should be in an arched position that gives you maximum strength when you're standing. Okay, again, that spring of the low back acts like a shock absorber, and if it's straight, your low back is straight, then when you walk and run, you get all that pounding to your low back, and you'll get low back pain eventually. This can also be used for hunchback, like hyperkyphotic or upper back excessive curvature. That's called a hyperkyphosis or hunchback, dowager's hump. It's not going to magically straighten it out, but part of what causes that condition is weak muscles in the back and contracted ligaments around your spine from the front of your spine. And instead of this being placed in your low back, you place it up higher like this and try to reduce that hunchback. I'll show you how to use this. It's pretty straightforward. So place it on a mat so it won't slide. Sit up against it like this, and very slowly, at your own pace, you're in control, kind of walk your way backwards or lay down. At this point, if you feel any pain, and you can sense if you're going to be able to do this or not, if you feel like it's not going to happen, just stop. All right, maybe try it again later. But ease yourself down like this, like that, okay? And if you feel like it's not quite where you want it, you can always shift around. And you'll know it, your body will tell you when it's right in that sweet spot. Mine's is about right there. So, I'll get my arms out of the way. Bend your knees. All right, bend your knees like this. For some people, I'll warn you, it may be difficult to breathe because it stretches your diaphragm, the muscle that controls breathing, so be careful with that. And just let it do its thing. Stretch your back, put your low back into that lordotic curvature. I wouldn't go more than 10 minutes on this. And when you get up, same thing, use your arms. All right, keep your back straight like this and kind of let it settle before you attempt to stand up. Now for the hunchback, just bring it back a little further so that when you lay on it, it's in the middle of your back. Position yourself. And for this one, you're not going, if you have a severe hyperkyphosis, you're not going to be able to lay down all the way. Okay? So go like this and use your hands to support the back of your head and the weight of your torso. I'm going to come down some more. For me, it's about this position. And then you're actually using your abdominals to lower you as far as you're going to go, okay? Now for some folks, that hunchback is so rigid, that's the most they're going to go, whether they like it or not. But use the weight of your torso to stretch it as much as it'll go. Okay, and the idea is that if you do this enough times, you'll notice that you'll be able to get lower and lower, all right, as those ligaments around your spine lengthen. So again, like this. For me, I could actually go even lower. But this position, you do not want to stay in for very long, because now I've got my head tilted at an angle and blood's going to go to my head, okay? And I might get dizzy. You definitely don't want to get dizzy and pass out doing this. So, you know, get that stretch. You could even move from side to side like this to enhance it. You may hear some pops, right? And then when you're done, see right there, I feel a little lightheaded, so be careful with this one. Just keep that hand here for support and just walk your way up. For more great tips on self-treating and sometimes resolving common cases of musculoskeletal pain, subscribe to my channel and visit my website, painandinjurydoctor.com. Thanks for watching.